Everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about some of the top questions to ask your surgeon at your pre-operative appointment. Hey everyone, so today we're talking about what are some of the top questions to ask your surgeon on that appointment that you have prior to your surgery. So pre-operative appointment, typically this is a couple weeks before your scheduled knee replacement surgery. What are some of the questions and important information to get prior to your surgery? So one thing to really have clarified and talk about is what are the specifics of your knee replacement surgery? So what are the details and the things that are going to be specific and unique to your surgery itself? For example, are you having a partial knee replacement or are you having a total knee replacement? What type of incision closure is the surgeon using? Are they using the staples or glue, or do they expect to use something else? Are there any other different details or things that the surgeon is going to be aware of and going to be checking for based on your individual body and your knee and your leg? For example, do you have risk factors that the surgeon is going to be very particularly on top of and paying attention to? Some other things to talk about are what are some complications and things to be aware of. So both during the surgery and leading up to the surgery, as well as those days and weeks after surgery, what are some of those red flags and things that you want to keep a lookout for? And in that same note, what are some things that are very common? What should I expect after the surgery in terms of what symptoms, what pain levels, what amount of swelling or stiffness or things of that nature are normal, and then what are maybe some of the things that are not normal and things where I should reach out to the doctor, to the surgeon, in case something like that were to come up, some of those red flags. Other things to talk about are what are going to be the strategies to manage your pain after surgery. So things like getting a prescription for pain medicine, what alternative or other techniques are being used. For example, will you have a femoral nerve block during your surgery? What type of anesthetic will be used during the surgery? Will you have a general or a local anesthetic? Anything that's going to be unique to your surgery itself? These are good questions to ask. And then what are some of the details of the day of surgery? So what's the schedule like? What can I expect to be the order of things, the timeline of things that occur on the day of surgery? What should I bring with me to prepare, or what special information should I have? What should I do to prepare while I'm still at home the evening or night before surgery, or that morning of surgery? What should I be doing to prepare and make sure I'm ready for surgery that day? Some other things are, what are the details of my stay in the hospital? So where can I expect, what kind of room will I have? Will I have my own room? How long can I expect to be there? What will my days consist of? Will I have physical therapy? Will I have any other things going on? Important details of that actual stay in the hospital if you are planning to be in the hospital and not having an outpatient type of surgery. Some other things to talk about are there any other appointments or any other things that I have to have done? So is there any other testing or screening that I have to do before surgery? Is there a joint class, a knee replacement, pre-op preparation class that I have to attend or should be attending? Any other appointments of that nature? And how do I prepare myself leading up to this surgery? So what can I do physically in terms of exercises and prehab? What can I do to prepare myself mentally and psychologically? What can I do to prepare my home for my return after surgery? Do I need to buy any equipment? Do I need to make any adjustments to my home setup? And I would also ask, with all this, what are some other resources you can point me to? Or do you have any other information that I can be as knowledgeable and as on top of this as I need to be and proactive about my surgery? And do you have contact information, and who should I reach out to if I have any further questions is a great thing to know as well. And then another thing that might not necessarily be with the surgeon, but something that is very important to be on top of and to know all about is in terms of the details of the cost and the insurance coverage for the knee replacement surgery and the care leading up to and after that surgery. So that's something obviously that is going to be more discussion with your insurance provider as well as the billing office of the hospital or facility that the surgeon is affiliated with. But also very important information to know and understand prior to having your knee replacement surgery. So these are just some of the important questions to ask. It's not an all-inclusive list of everything. There's certainly going to be some questions that might be specific to you and your circumstances. There might be specific questions about COVID precautions and, can I have people come in the day of surgery with me, or do I have to just come in by myself? Should I be wearing a mask? Most likely yes. Other things like that. Or there might be just things that are specific and unique to you. Take the time during this appointment to ask all the questions that you might have, even if they might seem silly or not important. This is your time and it's your knee replacement, so really make sure that you're fully prepared, as well as, more importantly, fully comfortable with leading up to and being ready for having knee replacement surgery, and know what it's all about and know what you're going into and what to expect. Thank you very much for watching, everyone. This has been the Knee to Know Show. I'm Dr. Luke Peterson, physical therapist. As always, if you like our content, we'd love if you subscribe. If you're catching this on the YouTube channel, be sure to check out our website and our group on Facebook. And as always, thank you very much for any likes or comments or hearts. We appreciate all the feedback that we get. Thank you very much for watching, everyone. Have a great day.